Stay home, stay safe is how the provincial government urged a restless population to fight this pandemic. It's a request, not a command. That's life in a democracy, where the rights of citizens have to matter to the people they put in office to run things. In a crisis such as this one, has that tension led democratic governments to be too timid? Has it left them less well-equipped to do battle against a threat such as COVID-19? Let's ask. Just outside Sacramento, California, Amir Attaran, a professor in the faculties of law in the School of Epidemiology and Public Health at the University of Ottawa. On Manhattan Island in New York City, Ian Bremmer, president and founder of Eurasia Group, a global political risk research and consulting firm. And in our nation's capital, Tonda McCharles, senior reporter in the Ottawa Bureau of the Toronto Star. And it's great to have you three with us here on TVO tonight. And as Tonda, always like to say to your colleagues, I think this is the fifth of these democracy agendas we've done with the Star. We're really enjoying it. It's going very well. So thank you for participating this week as well.
Thanks for having me. I'm happy to partake in this. It sounds like a fun conversation.
Amen. Amen to that. Let's start with this graphic here. A year into the pandemic, we want to just sort of take stock and see how different jurisdictions around the world have been coping. So Sheldon Osmond, if you would, let's bring this up here. This is COVID-19 confirmed deaths per million people. And the United Kingdom is actually at the top of this chart, 1,851 confirmed COVID deaths per million people. The United States comes next, 1,614. Then the European Union, just under 1,300. Canada, just under 600. Australia, 35 and change. New Zealand, well down the list, only 5.4. China, 3.4. And Taiwan, less than 1. That from worldindata.org. Ian, start us off in this. The Director General of the World Health Organization declared last month that, and here's the quote, in many ways, China actually is setting a new standard for outbreak response. So let's start with that. Has the authoritarian Chinese dealt with this pandemic better than the democratic West?
Ish. Number one of all the numbers that you put up there, that's the Chinese number is the one that deserves an asterisk. We don't completely buy that they've been straightforward with their people or the rest of the world about exactly how many people have died from COVID. The numbers are not going to look like American numbers, but they're probably a multiple of the numbers that they're actually showing. Secondly, we do know that the fact that the Chinese government covered up the initial outbreak, human-to-human transmission of coronavirus for weeks, while hundreds of thousands of Chinese from Wuhan were leaving, not just Wuhan, but leaving the country. This pandemic would not have occurred if the authoritarian Chinese government had been as responsive and as transparent about the outbreak as the Canadian government, the American government, the Australian government would have been. So it is disingenuous to simply say China wins on the back of all of this. But certainly after the Chinese took recognition of what had happened on the ground and started combating it, they've been incredibly effective. For a country of 1.4 billion, they have incredible surveillance. They have extraordinary authority. They have the ability to lock down their people. And that allowed them not only to restart their supply chain really by last May, June, while the rest of us was still reeling, responding to coronavirus, but it also meant that China was the only major economy in the world last year that experienced growth. So both from an absolute healthcare and numbers of people killed perspective, and also the ability of the economy to rebound, there have been real capacity that the Chinese authoritarian government has shown that they can indeed respond effectively to a pandemic.
Well, that leads nicely to my next question for Amir, which is that, there is an argument that Western democracies are making that we ought to be better at fighting pandemics because, of course, transparency is a big part of who we are, public trust, collaboration among different levels of government and with society, and therefore we ought to be better than authoritarian governments at fighting these kinds of global pandemics. What does the past year tell you about how firmly we can make that argument?
I don't think you can. I simply think the data that you showed, Steve, is unarguable. Certain governments categorized as democratic have done an awful job. Certain others, New Zealand, Australia, have done a brilliant job. Taiwan, and more than that, by the way. Look, at the end of the day, this is the point that I think is overlooked in the debate. The number of deaths you get from COVID is both because of an agent and a cause, but the virus is not the cause. The virus is the agent of disease. The cause of the disease is the strength of your political institutions and their resolve to fight the virus, be it an authoritarian state like China or a democratic state like Canada. The agent of all those deaths is government in both cases. And what we've seen is that you can have a strong agent that stands up against, a strong cause in the government standing up against the virus in a democracy or in a dictatorship. It doesn't actually matter. What matters to this apolitical virus, the virus has no politics. It doesn't care about democracy. It doesn't care about dictatorship. What matters is the strength of the measures you adopt to fight it.
That's an interesting distinction, agent versus cause. I haven't heard that before. So thank you for putting that on the record. Tonda, just before I get you in here, I do want to play a clip from a documentary that TVO aired last night. It's called Outbreak, the Virus That Shook the World. And it features Sir Paul Nurse, who's the director of the Francis Crick Institute in London, UK. Let's play that clip and then I'll come back at you with a question. Sheldon, if you would.
Across the world, around 10,000 a day are now dying from the virus. The overwhelming majority in the Western world.
What we've perhaps learnt is that there can be a conflict between the individual versus your responsibility to society. And the ability for the East to have dealt better than the West may be related to that. And the conflict between individual and society is so well illustrated in the United States.
And let me pick up on that, Tonda. Canada versus the United States. You've obviously been covering the story from the nation's capital and your perch there, and perhaps are able to come up with some theories as to why Canada seems to be doing so much better than the U.S. And one idea maybe is, are they too individualistic and we are more communitarian, and that's our big leg up?
I think we like to pat ourselves on the back sometimes and be smug about that to a certain degree. Sure, Canada is traditionally known as a country that sometimes places the collective interest ahead of the individual, and in contrast to the very individualistic United States. But look, I don't think that while the U.S. had a really, really rough first 9 months, 12 months even of the pandemic vis-a-vis Canada, I don't think we ought to be smug. I think clearly many of the same flaws that bedeviled the U.S. response also existed in Canada. Look, there were tremendous issues with data collection. The same sort of national versus subnational government overlaps and distinctions of responsibility that exist in the U.S. sort of exist here too, to a great extent in our healthcare system. And so I think it would be a mistake on Canada's part to feel that somehow we did so much better. Look, we actually did way worse than the U.S. in terms of long-term care deaths. And I think what this pandemic has shown me to a great extent, I've been going through thousands of government documents that have been slowly trickling out about the government's response. And I'm so struck by a couple of things. Many of the lessons that we should have learned from the 2003 SARS epidemic, we didn't learn. Our emergency strategic stockpile was an utter mess. We had no resilience when it came to personal protective equipment. And so, to that point about whether the East versus the West did better, or whether, it's individual versus collective, I think there's another fault line all across the board that this pandemic has shown. It's the embrace of globalism versus perhaps national self-sufficiency, if we'll call it that, or nationalism or protectionism. I mean, we see real trouble that befell many countries as a result of their lack of self-sufficiencies in all kinds of areas, and laid us open to, this very tricky, sneaky, effective virus. As Amir said, the virus itself is it's an effective agent of infection, and yet, there were other causes of why this thing spread like wildfire, why so many of our elders have died as a result.
Right, and Canada's inability to make vaccines here at home has certainly been part of the story here in this country.
Oh, goodness, yes.
Yeah. Ian, you're the one American among us here, so I should ask you to weigh in on that last question about whether you're, Amir, are you American as well?
I am.
I didn't know that.
I'm
Okay.
dual.
You're dual. Okay, gotcha. Okay, maybe I'll have to hear from you on this as well. The notion that America's so-called rugged individualism may have played a role in the fact that your death count is so much higher and disproportionately higher than ours. What do you think, Ian?
Well, look at my ruggedness, obviously, not to mention my individualism. Look, I think it's very clear that it's a good Canadian quality not to want to fall to smugness as well. So we're all playing to our stereotypes. I guess if I wanted to really be contrarian, I would say that despite the fact that the United States had been governed by the most incompetent executive of our lifetimes in the middle of the worst crisis of our lifetimes, right in an election period where the politics were maximized. So in other words, it's a trifecta of really unfortunate coincidence. Yet, the United States was able to pull together the most effective economic response of any major economy in the world and able to pull together the most effective vaccine response, both in terms of securing vaccines, but also facilitating the research coordination of all of these companies that were working on it. And now we're rolling that vaccine out under a different administration, but that was started under Trump. Now, in between all of that was, of course, the fact that the mask mandates got politicized, mask wearing got politicized. The president of the United States was organizing campaign rallies and basically telling people, show up and don't wear masks. That's an obscenity. The United States left the World Health Organization in the middle of a pandemic. That's an obscenity. So we made some pretty big mistakes, and that certainly facilitated the United States going down in the league tables in terms of the inability of the U.S. to effectively combat this coronavirus with basic common sense health measures. People weren't listening to the CDC. They weren't listening to the scientists. And what we've seen, the lessons that we've learned from democracies all over the world is if you politicize the response, and it happened in Mexico, it happened in Brazil, it happened in the US, it happened early in the UK, you will fail. And those are the countries that have had some of the least effective responses to coronavirus because the leaders refuse to lead with science sensibly. They instead politicize the crisis.
Amir, you want to weigh
and-
in? Oh, sorry. Go ahead, Tonda.
Well, I was just going to say I totally agree with that, but also I think that failure of U.S. leadership to sort of set an example for the world also hurt many other global responses in other countries. I think we all could have done with the U.S. at the forefront and displaying to the world, its ability to innovate, its ability to be nimble and agile in response to this. I think the U.S. leadership was sadly lacking, and it's not just because it pulled out of the WHO. The message that was being broadcast around the world at a crucial time was very much contrary to public health.
Amir, how does the dual citizen that you are weigh in on this?
I think both of what Tonda and Ian have said is quite right. Look, at the end of the day, the virus and all viruses, every pandemic virus from the past to the future, is an amoral, apolitical agent. It doesn't have a brain. No virus has a brain. It just obeys a mathematical logic. And the governments that screwed this up, that did badly, did so because their politicians were sufficiently stupid to believe that they could cut political deals with a brainless virus. At the end of the day, it all comes down to that. When Donald Trump says it's going to magically vanish, that is trying to cut a deal with a virus. When Doug Ford says, I'll open up and I've got my hand on the emergency brake if I need it, everyone should be personally responsible. You've heard that absurd rhetoric from him. That's trying to cut a political deal with a virus. Politicians who try to manage viruses the way they manage other stakeholders by cutting deals, because that's what politicians do. Their business is cutting deals between competing stakeholders. Any politician who tries to deal with a virus through that same paradigm will fail. And the successful governments of the world simply rejected that paradigm, be they democratic or authoritarian.
I'm going to read something here from the German novelist Thomas Brussig, who published an op-ed in Die Welt, The World. And here's the core of his argument, and then we'll come back and chat about this. The weak spot in our system is evident in the lack of agility and the inability to adopt the necessary measures. Political debate is decoupled from science. All too often, politicians ask what they can impose on the people or how long one can expect people to accept it, as if that were what is at stake. A virus is out of control, a virus that is open neither to negotiations nor to persuasion, nor even to intimidation. If we want to get rid of the virus, we are forced to take certain measures. Thanks to science, we know which measures are necessary. We even know what price we will have to pay if we fail to take them. Risk more dictatorship should be the order of the day. The fact that it is precisely the corona deniers who project a corona dictatorship should be reason enough to pursue one. The deniers are incapable of gauging the danger of the virus, but they do have a sense of how we might overcome it. Now, Amir, there are echoes of what you just argued in that passage, but it goes well beyond that as well. Why don't we just go around our virtual table on that one? The call for dictatorial powers in the name of science. Is that a reasonable thing to do?
It's an unfortunate phrasing to a correct reality. What is correct is that everything about a pandemic becomes fairly cleanly predictable after a matter of a few weeks or at most a couple months. The math is worked out, and you can make reasonable estimations about what the impact will be if you do try to interdict the spread of the virus, or if you don't, or what the cost will be if you do or you don't. All of this is on the table with actually fairly uncanny clarity. And governments that want to stave off the worst have to make use of extraordinary powers. I don't agree with the word dictatorial. Within democratic systems, there are safeguards on our human rights, of course, like the Charter of Rights and Freedoms in Canada, but they all come with exceptions for things that are of high importance to society as a whole. Our rights aren't absolute. The fact that they might have to be attenuated in a pandemic doesn't mean that there's a dictatorship afoot. It means that there's a sound government measuring risks and charting a sane course of action. I think the point that unites the United States and Canada in their poor performance, you asked me about being a dual citizen, is this. The politicians in both countries are simply scientifically illiterate. That's the problem. And with some greater scientific literacy in government and the public service, I'll add, you'd have better outcomes.
Tonda, how does that passage play in Ottawa?
Well, look, I don't think that anyone needs to go down the road of saying governments in Canada or the United States need to be more dictatorial. They need to be smarter. And very, very early on in this global pandemic, we were being told this is an international emergency. In end of January last year, the world was alerted, red flagged, this is coming. And to Amir's point, yes, everyone ought to have been smarter. But I think that's my point. Everyone ought to have been smarter. And if there was any doubt about how to handle it, we were getting early lessons. South Korea, Taiwan were showing us the way how to detect cases, trace them, isolate positive cases, quarantine potentially positive cases. There were clear roadmaps. And sure, everybody sort of says, oh, Taiwan's an island, Australia's an island, New Zealand was an island. They had, natural advantage. Well, actually, they also followed a roadmap of intensive detect, contain, trace, isolate, which is, never mind vaccinations. You can contain these things by following measures. And I think that, to just set aside anyone, thinking that we need to be more dictatorial about it. We need to also be more persuasive about it. And so there was a huge failure in Canada, I think, and an ongoing failure, frankly, around vaccinations and vaccine effectiveness and, the science, the evolving science around it, is communications. And I think that, we failed to bring in and persuade people because the communications around it, I have felt, and I know from reading all these emails behind the scenes, like there was a failure of transparency to citizens, and I think that has cost us.
Ian, based on your knowledge of democracies around the world, can you think of any that would be prepared to flirt with dictatorship if it means better public health.
I can think of a lot that would be prepared to flirt with dictatorship, even if it doesn't mean public health. I can see this happening in Brazil in next year's presidential elections. I certainly thought that President Trump and many of his Republican supporters in Congress were prepared to do that. You remember January 6th and what happened in that day in my own country. But I want to be clear. I think it's an incredibly irresponsible statement that you read out from that German novelist. We would not have had this global pandemic if it wasn't for the dictatorship of China. The fact that they lied about this coronavirus, the fact that they were not responsible with their own citizens, with the World Health Organization and the rest of the world, is what allowed the worst crisis the world has experienced in our lifetimes to be rested upon all of us. That's why we had to respond to it. So the idea that you magically can disappear that if only the rest of us were dictatorships too, are you insane? It's incredible how irresponsible that statement actually is.
Well, Amir, you have a funny way of winning friends and influencing people, which I'm being a little facetious about because I'm referring to your appearance before the Standing Committee on Industry, Science and Technology, at which you called Canada, quote, the least scientifically competent country in the world, and secretive to boot. I think we need to know a little bit more about what was behind those comments, so fire away.
In the world is an exaggeration. I think the context probably had me carried away. Look, among the developed countries that I'm familiar with, yes, Canada's got an absolutely inferior science establishment. I mean, I'm American. I trained at Berkeley, I trained at Caltech, then I trained at Oxford in England, so I saw the European science establishment. I worked in the pharma industry in Switzerland. I've seen the science establishment in a lot of places in action, including a lot of developing countries that did a fair bit of work on health and global development in Africa with Jeffrey Sachs back in the day. And I've got to say, Canada's science establishment, its representation of science in government, in the public service, is absolutely the worst of any developed country I've worked in. It doesn't measure up to the US, doesn't measure up to the UK, doesn't measure up to Switzerland, and many other countries I'm familiar with too. Now that's a sad reality, but we do spend very little on research and development in Canada as a percentage of our GDP. We spend about a third as much as South Korea. In South Korea, you've got to remember, is a country that in 1960 was poorer than Ghana, poorer than West Africa. Countries advance based on their investments in science and technology and whether they place science in a proper social context, which means at times placing it on a pedestal because it's the only thing that can save your bacon during a pandemic. This is something Canada fails to do. And if I look forward 30 years at the world, I think Canada will not be a very good place unless it changes that.
Tonda, maybe I can get you to react to that statement in this regard. You and I have both covered politics here for a long time, and you look around, and there frankly just aren't very many people who've come up through the scientific or engineering ranks who end up in public life. I note that Kirsty Duncan, who's a Nobel Prize-winning scientist, was actually dropped from the cabinet before.
No.
Was she not dropped from cabinet?
She was dropped from cabinet, but she retained a sort of a House position. But she was put by the Prime Minister onto the special COVID cabinet committee, the advisory committee that they stood up in March. But you look, you haven't seen her anywhere talking. She's like an expert. I've got a book right there. She's written a book on the 1918-19 Spanish flu epidemic, so, but you don't hear her voice. The other voice. I haven't
seen her on TV once through the whole thing.
No, yeah. and you see very few. Actually, this is one of my complaints, and Amir will understand it, is that trying to access the scientists who do work in government is impossible. We can ask till we're blue in the face. They never come forward to explain some of the very basic concepts. And I think that Amir's correct. We have lost track, I think, of some of the scientific lessons we ought to have learned through SARS, through H1N1. This country was one of few in the world that actually really did experience huge death rates as a result of the SARS 2003 epidemic. And yet the precautionary principle that taught us about, for example, how so much of the reality lags behind, we we lost the thread on masks. We lost the thread on asymptomatic transmission. Canada was so scared by the impact of the WHO putting a travel ban on Canada and the early stages of the SARS 2003 epidemic that we were completely skittish about any border controls in this pandemic. From January through to March, Canada kept arguing, oh no, we're not going to do any restrictions on travel. We'll just, screen people at the airport by a questionnaire. There were no measures. There were no public health officials at the airports. So those are lessons we ought to have learned, science-based lessons, and we didn't learn them.
Ian, I'm going to ask you about a quote of yours in which you said, leadership is critical and the ability to create a shared sense of commitment and sacrifice is essential. I want to know, in your view, whether you think Joe Biden's got it.
He certainly has that orientation. You've seen over 40 years in Senate, if you wanted someone that could reach across the aisle, someone that had Republican and Democratic senators on speed dial, it wasn't Obama, it was Joe Biden. And the fact that we had a second impeachment in the United States that failed on party lines, but Biden didn't say anything, right? And he has done his damnedest in the first couple of months not to try to inflame what is today the most politically divided and dysfunctional of all of the major advanced democracies, the United States. But nobody's arms are long enough to reach across the aisle in U.S. politics, not across the aisle to the Republicans, and not across the Democratic Party, which has two very, very different wings, the centrist and the progressive. And that's why when you saw $1.9 trillion in relief just approved in the Senate, it was a party line vote. I don't think that's fixable. I think that this didn't start with Trump. It was Trump a symptom of something that is much, much deeper. That in the United States, we do have these animal spirits, these individualist animal spirits that drive U.S. economy to a much greater degree. It gives us more entrepreneurship. It puts more money into the sciences. But when Americans increasingly, when their labor is not as relevant, the social contract breaks. And that makes inequality in the United States far greater than in Canada or in Europe. We have structural racism in the United States that has gone unaddressed. We also have issues, profound issues of white men, undereducated, losing status as the demographics in the U.S. move towards minority white in the 2040s. Those two things are much worse in the U.S. than they are in Canada, than they are in Europe. Plus, the technology companies play a much more dominant role, and the social media in particular, with algorithms driving people towards only following the things they already agree with and hating everything else. That the fact that your political opponent is your enemy, as opposed to someone that you just spar with to try to get to a better outcome. That is a bigger problem in the United States than it is in your Canada, or than it is in Europe, or Australia, and New Zealand. That clearly has made responding to the pandemic a much greater challenge in the United States. And also, as has been mentioned on this show, it meant that American leadership globally has been absent. And the fact that Joe Biden has said, I reject America first, I mean, the U.S. isn't exporting any vaccines at this point, even those that we're not using and that we won't need to use. We're not exporting them. I mean, it sounds multilateral, but there's still a lot of America first going on there. And I think we need to understand that until the United States gets its own house in order domestically, and you could have politicians that could reach across the aisle effectively, the absence of American leadership on the global stage is going to be felt.
Amir, I've got a couple of minutes left, and I want to put another one of your delicious quotes to you. Because you said, we have lost the hard bastards who are the people who need to lead in times of pandemics. We instead gained the world of gentle social scientists, and they are just constitutionally unfit for some of the decisions required in a crisis. Let's unpack as much of that as we can in our last couple of minutes here. First of all, who are the hard bastards you're talking about?
The people who, for instance, spearheaded smallpox eradication around the world, and before that combated malaria and shrunk it to a fraction of its range, and yellow fever and that kind of thing, polio. Once upon a time, public health had an almost military-like discipline to it, and it vanquished in large part so many of these terrible infectious diseases. And then the culture changed, because what became the public health priorities, such as forcing smoking out of society had to be done not really by force, but by cajoling, by nudging, by persuading. You had to persuade people to quit smoking. You had to persuade people about safe sex for AIDS. You had to persuade people about the dangers of opioids. And so it's selected for a different type of person in the public health establishment. The social scientists, rather than the people with an absolute bludgeon to crush malaria, smallpox, polio, or what have you. And with that change of personnel has come a change in preparedness for pandemics. No longer are the hard bastards really welcome in public health. When I talk like a hard bastard, and maybe I plead guilty to that moniker, I do not find my public health colleagues like it or me very much. Now, I'm fine with that. It doesn't injure me at a personal level, but it does open my mind to the fact that we have, as a world, in most countries, aside from some of those authoritarian ones, lost the preparedness to reach for the cudgel when a pandemic threatens us. And that is a vulnerability.
Let me get the last 30 seconds to Tonda McCharles. You see any hard bastards in Ottawa?
Maybe not enough. I mean, look, Amir is a contrarian. He comes standing committee. There's going to be fireworks. But I think that what this pandemic showed is even with the tools that are available to our governments, our political leaders are often very reluctant to use them. There are powers that the federal government has that some people have been arguing for a while they ought to have used. The ability to declare a national emergency, a national health emergency, and to have, I think, a little bit more of a uniform response across the country. Sure, he's right that also, the social scientists have the edge, but I'm struck by the fact that even the social scientists aren't getting their due. This government and its public health officials have admitted that they were not prepared, did not see coming the level of COVID fatigue, what a long marathon public health fight looks like. And consequently, didn't factor that into many of their decisions. And I would again argue many of their public health communications, the things that would have made a difference long before we got to vaccinations. That was a great discussion. Tonda McCharles from the Toronto Star, Ian Bremmer from the Eurasia Group, Amir Attaran, University of Ottawa. So good to have all three of you on TVO tonight. Much appreciated. Thanks for having us.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.